The purpose of this collaboration is to help people who are in this system of care, and the system of care really is comprised of the long-term care system and the primary and acute medical care system for people with disabilities as well as older adults. And the collaboration's purpose within that bigger system is to help improve clients' experience with that system, to help improve their health outcomes, and to help reduce overall costs.
The Population Health Partnership is serving a population that gets services throughout our community, all kinds of different services, and they're different organizations that are unconnected, but they are connected through this individual's life. And as far as the individual concerns, it's their story, and that's what we should be thinking too. So the mission of this collaborative is really to make it one story for that individual and coordinate our care.
The participants who are in this program that the collaboration is focused on, they are older adults and people with disabilities who are in family care and IRIS. And family care is the long-term care system funded by the state of Wisconsin to help people with disabilities and older adults. And IRIS is another part of that system. It's the self-directed system for those program participants.
Bellin Health is a community-owned health system, integrated health system here in Brown County. We serve northeastern Wisconsin, the Upper Peninsula of Michigan, and we take responsibility for the entire community, everyone in the community that we serve, and we want them to be the healthiest they can be at all stages of their life while providing the best experience and the most affordable care that we possibly can. Bellin's role in this partnership is really to make sure we bring that part of the health story. Obviously, there are multiple health systems in our community and all of them are at the table. But for the patients that we serve, that we manage their health with, we want to make sure we are open and willing and coordinating care with the other community members that are serving this individual, so we can bring that all together in a complete story about the person, not just the services we provide.
Innovative Services is a social services organization based in Green Bay, Wisconsin. We provide a wide range of services to people with developmental disabilities and other needs to help them live in their homes and communities. For the Community Collaborative, we serve as the link between the managed care organizations and IRIS and the healthcare providers. We're the ones who are contracted by the managed care organization to provide whatever services are necessary for an individual to live or work in their own community. And then we provide that support, often in the form of staff. We have traditional facilities such as adult family homes, community-based residential facilities, as well as less traditional and more innovative types of programming such as community-supported living, vocational services, working with youth and mental health as well. For the Community Collaborative, we work with the healthcare providers as the ones who typically transport individuals and accompany them to their doctor's appointments, and then help them to provide their regimented care at home in their own setting. At Innovative Services, we're really happy to be a part of this collaborative. We truly believe that in every person, there's a possibility.
Aspiro is a nonprofit that serves children and adults with developmental disabilities. Our purpose is to help them live happy, fulfilling lives and reach their full potential. We've been involved since the inception with the collaboration, and so we brainstorm ideas as a group on how we can go about choosing goals that we want to work for in collaboration again with others, and so we're proud to be part of that.
We operate family care in Northeast and Central Wisconsin, serving approximately 5,000 members with 300 staff. My role in the steering committee is as a community liaison for our members, as well as access to the community and bridging communication gaps amongst all parties.
TMG is an IRIS consultant agency. IRIS is the self-directed long-term care option. IRIS works with frail elders, developmentally disabled, physically disabled individuals in our community. Our role is to assist IRIS participants that would be part of this pilot program so that they would stay at the forefront of their community care team. So in the IRIS model, the person is in charge, and they would be the person who would be involved in coordinating their care. IRIS consultants partner with people in the program instead of act as case managers. An IRIS consultant would help people to get their plan up and running and look at their outcomes and what they want out of their lives and to get the services that they need to be able to maintain those outcomes.
At CP, we have 4 distinct programs: therapy services, providing physical, occupational, and speech therapy; early education and care and inclusive child care; an aquatic center with 2 warm water pools; and our adult day program, providing adults with significant physical and developmental disabilities programming. For over 64 years, CP has been celebrating all abilities and unlocking potential in our community. We are just one of the collaborating agencies that are working with Bellin as kind of the lead in providing the best health care we can for people with all sorts of disabilities in our whole community, and trying to increase the results and outcomes to the positive and decrease cost and overall duplication of service.
We offer a wide array of services for individuals with disabilities, seniors, and families, including day services, employment services, and community supports. We've been a part of the Population Health Partnership since the very start. As a provider, I think this group is such an amazing opportunity to collaborate with other community providers who share the same desire to improve both the experiences and the health outcomes of all the people that we really serve together. So rewarding to see us work as a team to more closely align our agencies to help deliver those services in a better way.
For over 40 years, CARE Wisconsin has been supporting frail elders and adults with disabilities throughout Wisconsin. As a managed care organization, we operate 2 of Wisconsin's long-term care programs, Family Care and Partnership. We also operate 2 healthcare plans, Medicaid SSI Managed Care and CARE Wisconsin's Medicare Dual Advantage. We work with our members, their families and friends, as well as our contracted service providers to support our members in their home with services such as medication management, skills training, transportation, and more. Our goal is to help our members maintain and increase their independence as well as thrive in the community. Our care management teams work with acute and primary staff to support our members' health outcomes as well as ensure safe discharge plans.
Because we're working together, we're able to have a much better impact on people's overall experience with this long-term care system. We're able to improve their health outcomes, and we're able to bend that cost curve in a very positive direction.